Hey everybody, this is Dr. Drew, the movement doctor with Modus Specialist Physical Therapy. And today we're going to come back and talk a little bit more about our series about no more pain. Today's discussion is going to be about the knee. Some of the more common injuries in the knee that we see with active population is patella tendonitis, right here, right underneath the kneecap, an ACL tear, a major ligament inside the knee, that's usually torn when the foot is planted and we pivot. And then also something called patellofemoral pain, where when the femur is rotating, when we're doing different movements, the patella has an issue with tracking along the same alignment as where the groove is from the femur and the tibia. Very common injuries that we see on a regular basis. Some of the movement patterns that we see that cause this knee pain is when someone's doing a single leg squat, or as if they're running, and every time they land, their knee goes into a valgus position, which is more inward inside of their vertical plane here. So what we don't want is that knee going past midline. By doing this, you get a lot of knee pain because one, the tracking of the patella will be off. The tension in where the patella tendon is going to be off base. And then also you put a lot of risk on the different ligaments and tendons in that area. So one of the best things to do for this is when you're doing a single leg squat, to try to keep the knee in between the first and second toe, and making sure you're not allowing your knee to go past your toes. Go up and down for me a few reps. Another issue that's causing the knee to go into the valgus is typically we see is glute weakness. So the reason why the glute is important is because the fibers are running at an angle like this. And so when the muscles are contracting, it's actually closing like this, which then pulls the femur into external rotation. If the glutes are not strong enough and you can't pull into external rotation, the femur naturally will go further into internal rotation. What we want to do is get these guys to contract not only concentrically, but also eccentrically. So with this exercise here, what we're trying to do is moving the pelvis on a fixed femur. So the exercise here, you may see the right leg be opening up, but the goal is on this left hip. So what she's doing is not allowing her knee to go in here into valgus while she's rotating her pelvis on this fixed femur with her foot on the ground. So this is actually called a standing clamshell, and the focus should be on this standing limb. One of the most forgotten muscles that we see when someone's dealing with knee pain is actually the quad, which is the largest in the area. So what we want to really do is isolate the quad to get it girth-wise the same and strength-wise the same as the other side. So with this exercise, a slow tempoed squat, we're going to have the patient go down on a 6-second count with their knee in contact to a wall and also their toe in contact with the wall. And then we're going to maintain that 6-second count, drop to about 90 degrees, and then come back up on a 6-second count. Holding on with their arms for counterbalance, but mainly should be focused on the quads and on the glutes. So go ahead and insert 1, 2, 3, 4, 5, 6. This is done correctly. The patient should definitely feel it right in their quadriceps muscle or in their glutes. So if you just tell them to transition their brain to send the signal to whatever muscle group you're trying to fire, this one specifically more the quad, they'll feel it more in the quad. Thank you for watching our No More Pain series. Don't forget to like and subscribe on our page for more information.